And you're welcome again to the midweek edition of the Marketplace. Let's start now for the very fair story. And the Association of Ghana Industries, AGI, says it is confident the upcoming Ghana National Card distribution will help ease the cost of doing business in the country. Chief Executive Officer of the AGI said Chuma Kwabwa has been speaking with Joy Business on the potential the Ghana card will have on local industries ahead of its rollout.
The distribution of national ID cards known as Ghana cards is expected to commence next week. The Association of Ghana Industries, AGI, says this will help streamline challenges that most SMEs face with the access to credit facilities. Speaking to Joy Business, Chief Executive Officer of the AGI, Seth Chuma Kwabwa, says the advent of the Ghana card will help revamp financially distressed industries.
In the past, AGI has been advocating for this. And we think it's one of the good policies that will help improve business environment and several other issues. You're right. The national ID could be used for so many purposes, one of which is the way of improving and streamlining our financial system. The banks always complain that when they give loans to enterprises, especially the SMEs, sometimes they are unable to track them. And for that reason, it increases their non-performing loans. And that has an effect because if you have high level of non-performing loans, it impacts on the the cost of credit or the cost of credit to businesses because you must cover it somehow. And therefore, the few that are performing, you always slap higher interest costs to cover your entire facility. So really, we think it's a good thing. And we need to be sure that it works out well and works out efficiently so that the purpose for which it is set up will be achieved.
Meanwhile, the AGI has welcomed the decision by the Monetary Policy Committee to reduce the policy rate to 17%. The governor of the Bank of Ghana says the decision to reduce the policy rate is because economic activity remains strong as non-oil growth continued to show signs of rebound following the slowdown in the last few years. Seth Chuma Kwabwa says industry players will feel the effect of the reduction only if it further translates into a further reduction in interest rates.
As the policy rate is dropping, treasury bill rate is dropping. Inflation rate is also being contained, and we are almost at single digit on 9.5. Is that so? Yes. So if all these macroeconomic variables are becoming stable, there's no reason why the interest rate shouldn't fall. So much as I may not be able to give you a specific rate because it's the financial institution's product, and that is the price of their product. So I cannot be here and be calling the price of another company's product when I'm not the business person doing the business in that product area. So they will be able to determine what the actual interest rate should be. But what I can say is that we are expecting a significant fall. So far, it's not been very consistent with the fall in the policy rate. The policy rate is falling. Interest rate has come down a little bit, but marginally compared to what we expect with the fall in the policy rate. So the difference is still too much. The spread is still too much. Let us see a significant fall, and that should happen.
The AGI believes that the coming on board of the Ghana National Card is just a single solution to the chain of challenges faced local industries in the country when it comes to the access to credit. Seth Chuma Kwabwa believes that local industries would have to focus on their corporate governance structures as well as the balancing of their books if indeed they would have to get qualified to access these facilities. Charles Ayeta reporting from the AGI headquarters in Accra.
Let us now turn our attention now to the capital markets. An investment firm, EM Capital, has filed a writ in court seeking to stop the Securities and Exchange Commission, SEC, from taking fresh actions that would hurt its reputation. This follows the decision by the regulator to place EM Capital under investigations and also warn the public not to deal with the firm for now. There's more in the following reports.
EM Capital has filed two separate writs at the High Court. The first one is an interlocutory injunction seeking to stop the regulator from taking action that would affect EM Capital's fortunes, as well as comment on actions that would not be in the interest of the company. The investment firm by this writ is also looking at preventing the regulator from looking at the option of withdrawing their license after the said investigation of violating the securities laws, which EM Capital is contesting. The second writ, which can be described as a writ of summons, is seeking to bring officials of the Securities and Exchange Commission as well as directors before the High Court and question them on how they handled the EM Capital case by not giving them the required hearing before giving public notice that they are under investigation for failing to pay back investment due. EM Capital was one of the 10 companies that the capital market regulator blacklisted because they are under investigations.
The Ghana Ports and Harbours Authority, GPHA, has finally reached an agreement with the company handling Tema Port Expansion Project, MPS, in terms of ownership. The deal would now see GPHA have 30% in Meridian Port Services, which is expanding container terminals at the ports. The deal means that the Ghana Ports and Harbours Authority has regained its controlling shares of the 30% in the company, which it lost some years ago. Paul Ansa is Chief Executive of the Ghana Ports and Harbours Authority.
Disclosing this in an interview, Chief Executive of the GPHA, Paul Ansa, says this development will assist in the quest to improve services at the port. He noted this means a lot to the Ghana Ports and Harbours Authority, especially when work on the expansion project is completed. The Ghana Ports and Harbours Authority held a 30% stake until recently when the shares were diluted to 15%. Paul Ansa says he is happy with the new arrangement.
That was diluted from 30% to 15%. That is what we came to meet. But I'm glad to say that there's a new understanding between us and the MPS, leading to the restoration of the shares back to its original 30%.
Okay, so now Gapoha will go back to its ownership of 30% in MPS. Is that what you are saying?
Yes, that's exactly what I'm saying.
And what would this mean to the company?
It means that we have improved shareholding, in the company. I mean, 30%, and they have 70% by virtue of the fact that that was a migration from the original agreement to where we are. Where we are was an amendment of the original agreement that was brokered several years ago.
The terminal operator, MPS, has since 1st April 2007 been at the forefront of efficient regional maritime trade. Key highlights of its decade's existence have been the introduction of sophisticated terminal operating systems, acquisition of high-tech cranes for terminal and yard operations, as well as initiating the $1.5 billion Tema Port expansion project.
It's aimed at providing facilities for handling containers, specialized facilities for handling containers, as well as expanding facilities for handling general cargo as well, and expanding our capacity, deepening the port to about 16 meters. That will enable us to take bigger ships, and then enable us also position ourselves, both Tema and Takoradi, for any future integrated aluminium industry, which we are waiting for.
After its completion, Tema will have one of the best container terminals in the sub-region. A Ben Sabote's report for Joy Business.
You're still live on the marketplace, and it's just a day to go for the much-awaited Joy Business Health and Wellness Trade Show, which will take place at the Accra Digital Center near the Kwame Nkrumah Interchange here in Accra. The trade show is expected to bring together many players within Ghana's pharmaceutical industry as well as the general public. It is under the theme Leveraging Research and Technology for Sustainable Access and Affordability. Sandra Fenu has been to the venue to acquaint herself of the extent of preparation so far for tomorrow's events.
Hello and welcome to the Accra Digital Center. And you're wondering what I'm doing here? Well, I'll tell you. This is where the Joy Business Health and Wellness Trade Show is going to take place tomorrow between 10 a.m. And we have a lot of programs lined up for these events. So it's basically issues regarding research and development in the health sector. So all the questions you have, you get the answers tomorrow at this very trade show. And as you can see behind me, the place is getting busy. What you're seeing right now is the setup for tomorrow's event. We have this these times where exhibitors will come to exhibit all their goods here. And so you have to be here to be able to get all those answers. But who can actually attend? Well, it's open to the public. It's just free of charge. So all you need to know is to get to the Accra Digital Center right at Circle. But how do you get here? So if you're coming from Circle, how do you get here? You need to bypass the Woodome Cemetery a little bit and then make a U-turn by STC, and then you get back onto the road as if you're heading towards Circle again. Right on your right-hand side, you see the Accra Digital Center. And also, if you're coming from Kaneshie, it's right after the STC. On your right-hand side, you see the Accra Digital Center. So you do not have to meet. Tomorrow's event is the Joy Business Health and Wellness Trade Show. Issues concerning your health will be here at the Accra Digital Center. You certainly don't have to miss this event. You surely have to be here for the Joy Business Health and Wellness Trade Show.
So you have to make a date at the Accra Digital Center for the Health and Wellness Trade Show starting at 11 a.m. sharp tomorrow morning. Still on the health sector, Minister of Health Kweku Agyeman is calling for more sources of funding for the National Health Insurance Scheme. The scheme, introduced to assist in the universal health care agenda, has experienced some challenges with funding undermining its effectiveness. In an interview with Joy Business ahead of the Wellness Show tomorrow, Dr. Kweku Agyeman says he believes policyholders should brace themselves up to pay more to be able to achieve the purpose for which the scheme was established.
All looking for sustainable sources of funding for health insurance, and at the appropriate time, I think this will be announced for all of us to look at. But what I'm pleading with Ghanaians is the fact that as we sit here, me and you, patriotic citizens, will be more comfortable, right, to see every single one of us having no challenges with accessing healthcare in our country. But when we have that objective, when we have that thinking, somebody should pay for. Not all of us can even pay the premium that was set how many years back. We haven't changed them. Now clearly, health insurance isn't getting itself sustainable, and we need to put in new sources. Who should pay for this? So at the appropriate time, I think that's why I said we're engaging. Kenyans should be bold, and let us all accept and commit ourselves to contribute some little to a pool where all of us can access. We are talking about universal health coverage. And because of that too, Ghana introduced the health insurance system across Africa. Right, we are about the closest country to begin to achieve what we call universal health coverage, even before 2030. So if you are able, right, to bite the bullet and say, okay, every Ghanaian, we have accepted, President, do something, we want to pay extra. Within years, Ghana can achieve universal health coverage, and we can expand our benefit package, and we can have a very resilient health system that will be unparalleled on the continent of Africa. Right, so I'm pleading with you guys. That engagement is still ongoing. At the appropriate time, will come out, and I want to believe that you guys will support us to market whatever thing we bring in.
Meanwhile, one of the leading pharmaceutical companies in the country, Ernest Chemist, is upbeat high-quality standards in Ghana's manufacturing industry is driving demand for locally manufactured drugs. Currently, Ghana's pharmaceutical market is made up of approximately 30% of locally produced drugs and 70% of imported ones. Ahead of the Joy Business and Health and Wellness Show, General Manager of the company, Ernest Chemist, Yao Bediako Sampong, says stimulating more demand for the local pharmaceutical industry is a long term for the company.
If you look at the region as, West Africa, it's perceived that Ghana, compared to other countries, the standard of our pharmaceutical products, it's quite high. So, you see that there's a gradual shift, from people buying imported products to locally manufactured products. And, there's a general statistics that 70% of the products that are consumed locally are imported, whereas 30% are manufactured locally. So we're trying very hard to try to see if we can turn that around in favor of locally manufactured products. So we see that gradually it's that consumer confidence. It's how you present the product, it's how you package it, and if people take it for the first time and it works, they'll be like, oh, okay, this product works and it's it's relatively affordable. So why go back and go and buy that expensive product from maybe UK or America or whatever? So it's a long-term objective. We are working hard towards it. It will take some time to convince everybody, that's 70% fully, to come and buy locally manufactured products. But there's some good progress that has been made, towards that goal.
So staying within the industry, effective healthcare delivery is usually a challenge in most rural areas. However, in the Amansia West District of the Ashanti region, health experts are using technology to make this a thing of the past. Karen Dudu reports.
Hello, this is Kumasi South Hospital. Baby Sata on the line. How may I help you?
This is a telemedicine center. Here, nurses use mobile technology to connect community health workers with health professionals via 24-hour teleconsultant centers. Nurses and midwives in the teleconsultation centers coach community health workers and advise on the treatment of their patients, particularly in emergency cases. Here at the St. Martin's Hospital in the Ashanti region, these nurses are bridging the gap that distance has created between patients and health professionals. Esther Foyua is the head of staff at the center.
What we normally do here, or our normal operations, is to receive calls from the remote areas, that's the villages, and the call comes from facilities such as the CHIP compounds, the health centers, the clinic, and sometimes the private hospitals. So when the call comes here, one person sits at the triage area and then transfer the calls. So when that person picks the calls, she will transfer to the various booths, depending on the one who sits there. So per every shift, we have the midwives and the general nurses. And most of our cases are maternal and the general cases. So if the case happens to be maternal, then we hand over to the nurse in the booth. Then the midwife will pick and then give her interventions. But let's say that the case is beyond her. She also conferences the call to a medical officer. So the three of them will be on a conference call. The nurse here, the medical officer, and then the one who called from the periphery. So the three of them will discuss the case, and then the medical officer will give his interventions. If the case would have to be referred, then we call the referral center for them to prepare.
In the rural population where access to specialist care is limited, telemedicine is gradually making an impact. In 2016, more than half of teleconsultations could be resolved directly by phone, including 31% that avoided referrals. Head of the telemedicine coordination team in Ghana, Dr. Kwabena Boateng Boache, says the Ghana Health Service intends to introduce a TCC to all 10 regions of the country by the year 2020.
Even now, we are thinking even without the boss. A time will come whereby, we have other systems running now, whereby patients can call. In fact, the last time we had that telemedicine stakeholders group, there was an example called Hewale, whereby it's a system work in progress which NITA is leading, where people can call to get care from a doctor. So we are looking at all these options, but you agree with me that we start small, think big, and grow big. So, and most of the time, the burden of disease or care lies in the periphery or the primary health care level. That is not to say secondary care and tertiary care is not important. So definitely we'll get there.
The Amansia West Telemedicine Center was funded by the Novartis Foundation in collaboration with the Ghana Health Service.
So it's all about health, and of course, don't forget tomorrow's landmark program, which is also the maiden edition of the Joy Business Health and Wellness Show, takes off and is happening live at the Accra Digital Center. Away from that, it's been about 2 years since the fall armyworm attacked several hectares of farmlands in the country. Scientists are still warning of the invasion of another pest known as tomato leaf miner, which is said to be destroying several tomato farms in the country. Assistant Ashanti Regional Agric Officer, Plant Protection, Michael Kuma, says the pest has been identified in the eastern, western, Brahafo and Ashanti regions.
According to the Food and Agriculture Organization of the United Nations, tomato leaf miner, also known as Tuta absoluta, is native to South America. The pest has established in parts of Southern Europe, North Africa, and the Mediterranean countries. The pest is devastating on tomato, with the caterpillar being the damaging stage. Life cycle from egg to adult range from 46 to 61 days and can undergo up to 10 to 12 generations in a year with overlapping generations. The adult female can lay 250 to 300 eggs in a lifetime. The larvae feed on leaves, producing large irregular mines on leaf surface. They also burrow into the fruits, and their feeding activities, both in the leaves and fruits, cause significant damage to tomato production. Losses can be up to 100% in greenhouses and open fields. Every stage of the plant is prone to pest attack, and parts affected are the bars, leaves, stems, flowers, and fruits. Mr. Kumar was worried farmers since 2015 have been using insecticides to control the pest, which he says is not sustainable. Though he says his outfit is working to curb the situation, he is advocating the use of integrated pest management, which involves use of all available technologies in pest control to salvage the situation.
This is also a new pest in our country, and it's very devastating. When it came, we didn't have much knowledge about it, so research is still ongoing. And we know for sure with time we also get to know how to control it. And most of our farmers who don't have any knowledge about how to control this pest. And because of that, we are encouraging every farmer to come out with their problem whenever they see anything that is so strange in their farming activities.
We use it because Deputy Director and Head of Pesticide Environmental Protection Agency, Joseph Edmond, warned farmers to desist from buying chemicals from broken containers.
And when the seal is also broken, anything at all could have happened. So we encourage farmers to buy the chemicals in a sealed package. Now, when the farmers take the chemicals and they want to use it, they have to use the chemical according to label instructions. Now, if the chemical on the label is not indicated that you should mix this with this, you don't have to mix. We know chemicals, the farmers mix chemicals on the farm. This is an illegality.
The Korea Africa Food and Agriculture Cooperation Initiative Kafasi Pesticide Young Scientists Pilot Research Project seems to educate farmers on the prudent use of pesticides. According to one of the coordinators, Stephen Arthur of the Crops Research Institute, the project will bring together stakeholders in the pesticide use value chain to address pertinent issues in pesticide handling.
That a lot of projects have come along addressing pesticide abuse. You know, people have problems with pesticide handling and they think that just the use of pesticides, you know, is wrong, but it's the abuse of pesticides that is wrong. And so what we want to do is to educate farmers and the general public about the dangers of pesticide use.
Reporting for Joy News, Kwesi Debra.
That's it for the marketplace for today. My name is Emmanuel Afwaji. We have to see you at the Joy Business Health and Wellness Trade Show tomorrow at the Accra Visitor Center. Have a good afternoon.